The nursing process, planning. Ethical, legal, and professional practice. Professional nurses have more accountability now more than at any other time in the history of nursing. Standards of care are met through prudent performance of the nursing process. Standards of care are determined by governmental and non-governmental committees and may be defined by local standards or national standards. The planning step is critical for guiding patient care to acceptable patient outcomes. The planning step provides concrete evidence to support the accuracy and pertinence of the patient plan of care. Conscientious practice of the nursing process and development of the patient plan of care ensures that professional standards of care are met. Life-threatening concerns versus routine care. Depending on the severity of the problem, the steps in the nursing process may be performed in a matter of seconds. Life-threatening concerns and patient situations must quickly be addressed. ABCs of life support can direct the nurse's prioritization. In critical situations, steps in the nursing process are performed through instant clinical reasoning and do not involve patient input. Patients should be included in the planning process. By accepting guidance and input from patients during the planning process, the nurse provides them with a greater sense of empowerment and control. A large portion of success in our progress towards achieving goals remains in the patient's power. Depending on the patient's condition or circumstance, it may be advantageous to include members of the patient's support system. Including patients and their families enhances the understanding of identified needs and increases their sense of ownership in working towards the established goals. The professional nurse is instrumental in communicating and teaching the steps necessary for patient improvement. It is imperative that the patient understand the plan of care and be an active participant in all nursing interventions. Setting priorities among identified nursing diagnoses is a first step in the planning process. Providing safe and effective care to all patients is a national priority. Nurses are constantly challenged by increasing patient comorbidities and greater complexity of patient needs. When making care decisions on prioritization for your patient in your functional dimension care plan, you may be able to apply Maslow's hierarchy of needs to help you make decisions on which of the boxes have the highest priority. On your 2 functional dimension care plan assignments this semester, you will be asked to put these boxes in order of priority for your patient. Deciding the order in which the nursing diagnoses are addressed depends on several factors, including the severity of symptoms and your patient's preferences. After emergent needs are dealt with, less critical problems take priority. For the 2 functional dimension care plan assignments this semester, you'll be completed the entire box on your identified highest priority. You will be labeling each box accordingly to the priority of need. You will be required to complete the first 5 items of each of the subsequent boxes, including assessment, meds, labs, order medical treatments, and the nursing NANDA diagnosis statement based on the assessment data that you've gathered from your patient assessment for each identified area of your functional dimension care plan. In the last lecture, we talked all about how to formulate a nursing diagnosis statement for actual, risk for, and readiness nursing NANDA diagnoses. So for this patient, actually has a physical immobility problem. So the NANDA diagnosis is a statement. It's an actual NANDA statement. It has 3 parts, and I've got each of them labeled. We have the NANDA label, which is from the approved NANDA list, the 3-part statement, which starts with the impaired physical mobility, related to, and then the etiology. What is the cause of this impaired physical mobility? Loss of muscle tone. AEB, or as evidenced by, are my 3 pieces of evidence that the patient complains of weakness, there's an unstable gait, and inability to ambulate independently. These are the 3 pieces of evidence, or the AEBs, that prove my patient has this NANDA label, impaired physical mobility. These 3 pieces of evidence also need to be listed in the assessment section of the functional dimension care plan for mobility. Once you have written your nursing NANDA diagnosis statement, you're going to want to make sure that the goals that are going to lead you to solving this problem and the interventions that you're going to perform to help solve this problem and lead you to your patient achieving their goals are in alignment. The NOC, NOC, and NIC, NIC are standardized nursing terminologies or labels focused on patient outcomes and nursing treatments. You do not make these labels up. You find them in your nursing diagnosis handbook. The outcome identification labels help ensure that the goals and interventions are addressing the same topics. If the goals are about mobility, then the interventions will also be about mobility and will be items that will help the patient meet their goals. Occasionally, the nurse and the patient will have conflicting priorities. Patients may have difficulty accepting and making necessary lifestyle changes. Identifying realistic goals that are acceptable to patients and include adherence to sound health care regimens requires time and cooperation by everyone involved in the goal-setting process. Planning that includes the patient teaching to support the goal attainment and explain the importance of implementation and interventions is the core nursing responsibility. The nurse must account for individual differences in goal planning to facilitate effective teaching and positive patient outcomes. Goals are broad statements of purpose that describe the aim of the nursing care. Remember that short-term goals should be met by the end of the shift, where long-term goals are met by 3 to 4 days or by discharge. Effective goals are acceptable to the nurse and the patient's family, appropriate in nursing and medical diagnosis and therapy, realistic for the patient's capabilities, specific, measurable, and understood by the patient and other nurses. Goals are statements designed in collaboration with patients to provide guidance and ultimately a measure of progress when addressing nursing diagnoses. Realistic goals. Realistic goals consider the patient's physical, mental, spiritual condition in relation to the ability to attain the goal. The nurse must consider the effects of conditions such as severe pain related to a recent surgery or clinical depression or hopelessness on the ability for the patient to reach the goal in a timely manner. Other barriers to goal attainment may be related to social or economic issues or available resources. Some goals may be too ambitious to attain and may need to be reevaluated and revised. Patient-centered goals. The goal should be specific to the activity the patient can exhibit or demonstrate in order to indicate goal attainment. These goals are written to reflect the patient and not nursing activities. The patient will walk in the hallway is a patient-centered goal. Measurable goals. Measurable goals. When writing a statement with the patient, the nurse needs to clarify and identify how to achieve the goal and how the goal will be evaluated. A measurable goal would be the patient will walk 150 feet in the hallway. It's not only a patient-centered goal, but also a measurable goal. Time-limited goals. Goal statements need to include a time frame for evaluation. The time depends on the intervention and the patient's condition. The use of measurable verbs when writing goals and outcomes is essential for establishing criteria with which attainment can be evaluated. Here's an example of a short-term goal and a long-term goal for impaired physical mobility. You can also see that we've utilized the NOC of ambulation. Okay, so I'm going to keep referring back to the Functional Intervention Care Plan, and remember I said you have to fill out the whole box for your highest priority. This is just a portion of that whole box. I want to go and put in the items that we've already discussed so far in this lecture. So under the highest priority, I'm going to say that mobility is my biggest problem in this patient. So I've labeled priority number 1 box is going to be mobility, and I'm going to fill out the entire box. From my assessment, now I probably would have a lot more assessment items in this box, but I'm just putting the ones that we've kind of discussed already today. So remember, I want to put normal as well as abnormal, and anything that is abnormal I also have highlighted. And you'll need to do this on your care plan also. So subjective, the patient said I am weak, so I'm going to go ahead and put that in there, and I highlighted it because it's abnormal. Objective, the patient cannot ambulate independently. The strength in the legs is 1+, and there's an unstable gait. So I went ahead and put that in there as the objective, and I went ahead and highlighted that because that's abnormal. Under medications, I know the patient's on ibuprofen and Lasix, so I know that both of those can affect mobility, and Lasix can affect potassium. And if you're not sure about that or don't know that yet, we will talk about that in a future lecture. In addition, I can know that laboratory values, an albumin level of 1.8, which is low, can affect my patient. So this patient had an albumin level of 1.8, and I also highlighted that. Now you're going to gather this data from your very own patients. So this is just a pretend patient in this case study that I'm doing with you on this PowerPoint, but it should give you an idea of what's going to be expected for you of this nursing care plan. The next thing is ordered medical treatments, and I've added their daily physical therapy because that's what this patient is receiving. Now remember, the NOC and the NIC are just labels. They come right out of your NANDA nursing diagnosis book. And what am I going to treat in this patient? I want to treat ambulation. So I went in the NANDA book, I looked at the NOC label and the NIC labels, and I want a care plan that's consistent with the same thing. If I'm treating mobility and all of a sudden there's something in there about treating constipation, then that's a problem. So the NOC and the NIC labels help to keep my goals in alignment, the NOC or nursing outcome. Remember, the outcome is a goal, so nursing outcome classification. The goals are going to be about ambulation, and then my NIC or NIC or nursing intervention classification, all my interventions are also going to be about ambulation. So this is a care plan that's going to be consistently treating mobility, which is what the purpose of NOC and NIC are, to keep the care plan in alignment so I'm treating the same type of things and I can help my patient reach their goals. Okay, so I've got then my NOC is ambulation. I'm going to be having goals that are about ambulation. And you can see here that I have my NANDA. So my NANDA label is nursing diagnosis, impaired physical mobility related to loss of muscle mass, AEB. The patient states, I am weak, unstable gait, inability to ambulate. Those are my 3 pieces of evidence that prove I have impaired physical mobility. And if not, I'm not sure if my patient fits that NANDA diagnosis, I can look it up in my nursing care plan book and look up the defining characteristics for how would I know my patient has impaired physical mobility. I look up defining characteristics and I bet I would find those certain statements. There's a whole list of NANDA diagnoses that your patient can have as far as symptoms that'll say that the patient either has this problem or does not have this problem. Okay, then my 2 goals. My long-term goal is by discharge, and my short-term goal is by the end of my shift. The patient will be able to walk 150 feet in the hallway by the 3rd day of admission. Okay, now that might be a little bit more than this patient can do, but I can always modify this plan in the future if I need to. Okay, my short-term goal is that the patient will be able to dangle at the bedside for 10 minutes, assisted, by the end of the shift. That means that they can sit up at the side of the bed. I probably will have my hand on them, so I'm sure they don't fall over. But if they're really weak, I may need to just start with having them at the bedside with their legs dangling off the side of the bed. And the NIC or the NIC, the interventions are also going to be about ambulation. We'll talk about those in just a minute. Okay, so I've gone to the next slide, but this is the second half of that highest priority box that you'll need to fill out for your patient. So in level 1, in the Nursing Functional Dimension Care Plan assignments, you'll have 2 of them this semester, you will need to fill out the highest priority patient problem. You'll do the entire box. The previous slide showed the beginning portion of that box, and this is a remainder of that box that you'll need to fill out for your 2 functional dimension care plans. The functional dimension care plan will also require that the remainder of the boxes that are left, you'll need to do the first 5 items in every single box. And you need to prioritize what is the next highest priority. So mobility is my highest priority is what I'm thinking here. The next priority box could be nutrition maybe, because remember this patient had a low albumin of 1.8. So I could do the first 5 items in that box for nutrition. I do not need to do interventions for that though. Only that first box gets completed out the whole way. So this is the second half of the highest priority box. So the priority, remember, is mobility. My nursing NIC label is ambulation. Remember, my care plan is about mobility and I'm trying to treat ambulation. My first intervention is always an assessment, because how can I know how to make this patient better unless I assess them first? So I want you to remember that number 1 intervention is always assessment. I also need to label it. In another slide, we'll talk about the labels. So there is an assessment. You can see D is direct care, M is monitor, T is teaching. And then I also want to label the interventions if they are independent or collaborative. Independent means I do them myself, or collaborative means we do them as a team. So my number one intervention that I came up here for my patient will be assess the patient's ability to ambulate independently on admission and Q shift. And then I need to put a rationale. So assess for mobility difficulties can alter safety and require rehabilitation intervention. So that's my rationale for assessing that. I want to go back for a minute though. So in my intervention, remember I have it labeled. So it's A because it's an assessment, it's I because it's independent, and then I have assess the patient's ability to ambulate independently, and I have to say how often. So the second part of that intervention on admission and Q shift tells you, and it tells me, how often am I going to do this intervention? And you need to have that for every single one of your interventions. The second part of this statement, assess for mobility difficulties that can alter safety and require rehabilitation interventions, is the rationale or the reason why I'm doing this assessment. And then I had to, in the nursing care plan book, look up who was the author of this rationale, who did the science, who did the study. I've got to give them credit. So this is the only place in the nursing care plan I'm going to cite that. So Smith, 2020. Now, I only listed one intervention. You need to list a total of 5. So you need to assess. Number 1 is always going to be assessment. You need to also do interventions for direct care, monitor, and teaching. And your 5th intervention is whichever one you want to do. Now, the next thing is the actual outcomes. Actual outcomes is what happened when you did the above numbered intervention. So when I grade your nursing care plan and I'm at home and I'm grading this, I want to see when you put actual outcomes for number 1, I should see what happened when you did the number 1 intervention. So you can see the patient has an unsteady gait, the patient uses a walker, the patient was strong prior to admission but has bilateral weakness with 1+ strength in both extremities. That's an actual assessment, what I did when I did that number 1 intervention assessment. So number 2, I would do another intervention, and then number 2 actual outcome would be what happened when I did that intervention. So they need to correlate. So it says here, the number 1 actual outcome should be what happened when I performed the number 1 intervention above. These should correlate. So if you have any questions about that, please let us know. It is important for us to follow through with that. So I have some students that will put actual outcomes. They may put something like, I assessed the ambulation on admission. But that doesn't tell me what happened when you did that with your patient. I really want to know. So you told me in the number 1 intervention, you're going to assess their ambulation. What happened? How was it? I want to know how it was. Tell me how that ambulation was. Was it weak? Was it strong? Are we fixing it? Is it still a problem? So tell me what happened when you assessed it. So please just don't reiterate what you're going to do in the intervention. Please tell me in the actual outcome what happened when you actually did that assessment of ambulation. So I think that this actual outcome I have here is pretty clear. It definitely shows you that there's still an unsteady gait, that the patient uses a walker, the patient was strong prior to admission, but has bilateral weakness with 1+ strength in both extremities. So the final thing you'll do after you've done your 5 interventions and your 5 actual outcomes is you will do an evaluation. It'll be just a short paragraph that'll review if your patient met their long and short-term goals and if your care plan needed to be revised or modified at all. So if you guys have questions about this, we definitely will be discussing this in class and give you some practice on this too. But I hope this slide is very helpful for helping you understand what's going to be expected of you for this assignment. Okay, so this slide just gives you some more detail about the intervention section. So remember, you will need 5 interventions. The first intervention is always an assessment intervention and is labeled with an A. You'll also need to include 4 other interventions. This will be a direct care, a monitoring, a teaching, and then the 5th one is whichever one of those you want to repeat. You will need to label the interventions what type. So you will need to label them either assessment, direct care, monitoring, teaching, and then you'll also need to label if they're independent, meaning I can do them myself, or if they're collaborative, meaning we do them as a team. Be sure to include how often you'll perform each intervention at the end of the intervention. So you can see here I said, assess the patient's ability to ambulate independently on admission and Q shift. So how often will you perform that is a very important part of that, whatever the intervention you're going to do and how often you're going to do that. Include the scientific rationale of why in the next statement. You can kind of see here, I actually italicized this rationale to kind of bring it out. And I kind of like that when students do that because it really helps me notify where you stopped on the intervention and where the rationale starts. So assess for mobility difficulties that can alter safety and require rehabilitation interventions. And remember, this is a scientific study that someone did, and I need to give them credit. So I've got Smith, 2020. So you do need to include an in-text citation at the end of your rationale to demonstrate the source of your scientific intervention. A lot of these interventions can be found in your nursing care plan book. So if you look up altered mobility, you can look up and find interventions that you can do for your patients that meet all of these standards: assessment, direct care, monitor, and teaching. And then just label them either whether they're independent or collaborative. You do not need to have a certain number of independents and collaborative. You just label them. If they're independent, they're independent. If they're collaborative, they're collaborative. So this is just one example of an intervention. You definitely will need 5 interventions for your nursing care plan. I hope this slide was helpful. In nursing, we definitely are using evidence-based practice. So you want to encourage nurses to integrate evidence-based practice care requirements into their practice. This is done when you do your interventions. So remember, we're having you look up the scientific rationales for why do we do these interventions. What is the proven science to make these interventions the best thing what we're doing to help our patient get better? So utilize those interventions and look up the rationales. That is the science behind why these interventions are the best measures to help the patients reach their goals and to get them home sooner. So here's just another example of an intervention. So remember, number 1 intervention is always assessment. So I've got it labeled AI. Assess the patient's lung sounds. And remember, I have to do how often. So each shift, period. And then in italics, you can see I looked up the science behind this to find out why do we listen to the patient lung sounds every shift. And the science said lung field assessment on a routine basis has proven to be an effective screening tool to monitor for fluid overload and signs and symptoms of pneumonia. And that was said by Smith, 2020. So I'm giving them credit because this is their study. So again, I've got my intervention, how often I'm going to do it, and then in a second sentence, I'm going to put the rationale for why I'm doing it, the science behind why I'm doing that intervention, and then I'm also giving credit to that author of that research study, Smith, 2020. And then be sure that you're labeling this. Remember, number 1 assessment, number 1 intervention is always assessment, and I've got this labeled A because it's assessment and I because it's independent. I can do it on my own. The level of healthcare literacy in any given patient population is a major concern for nurses. Most adults have difficulty completing routine health tasks such as understanding a drug label or a vaccination table. Nurses must recognize when patients are struggling to understand health-related instructions, identify a patient's usual means of compensating for health literacy limitations, and intervene appropriately. Early structured discharge planning ensures smooth transition of a patient from hospital to home. A structured collaborative approach that focuses specifically on the needs of at-risk patients has proved beneficial. Use of planning and documentation tools has improved patient outcomes and satisfaction associated with hospital to home transition. Discharge information should include medical information, patient goals, interventions to accelerate recovery, interventions to provide needed care. Inadequate discharge planning can lead to an increase in patients returning to the hospital, more frequent emergency room encounters, and also adverse events. The next phase of the nursing process is the intervention phase. We'll also cover the evaluation phase in the next PowerPoint.